There's 3 pictures, and you can come and see these pictures over at Vim and Vigor. And
I've seen these pictures.
Yeah, so I mean, why do these sores start popping up on people with diabetes?
It's because you have edema. The body is not able to circulate, so the toxins build up, and the body just can't handle any more poisons. And your skin's the largest eliminator of toxins. So a lot of times you see people with, it's like a lot of people with psoriasis. If they were on Ketsumeisei and Vitalzym, they probably wouldn't have psoriasis. The only other reason for psoriasis is yeast. Their food is too rich in yeast products, breads.
Yeah. So Ketsumeisei and Vitalzym can help people with psoriasis?
Well, you're dealing with inflammation, and you're dealing with poor circulation. I mean, don't get me wrong. If you're not getting vitamin D, of course, where you live, if you're not getting vitamin D, there's something definitely wrong. Now, in the mainland, in the wintertime, we don't get sun all year round like you do. But I've had people with psoriasis. We put them on vitamin D because they can't go out in the sun because it just makes it worse. Well, they need to get the vitamin D up, but in the meantime, if they would be on the Vitalzym, that will help with the inflammation that's already there.
Okay.
I mean, nothing's a cure overnight.
Right.
Nothing.
Yeah.
But if you do those simple steps, you'll get the goals and reach them that you want. But you got to work at it.
So again,
the body will do all the work for you. It just says, give me the supplies I need to do the job.
Time will do the work, your body will do the work, but it needs to have the nutrients, it needs to have it in the right amounts. And right, you're telling me 3 is not enough. If you have surgery of the Vitalzym, you have to have it in the right amounts, and you have to take it for long enough. So,
and even if you haven't had surgery, but you have arthritis of whatever kind, I don't care if it's rheumatoid or osteo or whatever, you need to take as much as you need on that schedule that I said. Start off with 3, wait 4 days. If you still got a problem, you need 4, and then 3 more days, see how you're on the 4th. Add again, keep adding. You'll reach the level where your tanks are getting full and it's starting to deal with everything. Then you start cutting back to the maintenance to keep your bucket full. And maybe 2 or 3 will be enough to do it. Everybody's different, though.
So speaking of dosaging, then what is the proper dosaging for the Ketsumeisei for people with circulation issues, diabetes specifically? We talk about it because it works on the liver, right?
It works on the liver, but I mean it's working throughout the system.
Okay.
But yeah, if you were a type 2 diabetic, for an example, you may have to go up to 3 packages of Ketsumeisei a day. For somebody with a lesser degree problem, 1 a day, but it has to be on an empty stomach. That's very important. Vitalzym has to be taken on an empty stomach. I'm talking 20 minutes before a meal or 2 hours after a meal.
But you can take the Vitalzym at the same time as the Ketsumeisei?
I wouldn't.
Oh, really?
I don't want my body to have to overwork. I want to give it one thing and have it concentrate on that. So I mean, if that was the thing, because Ketsumeisei is going to work very fast. So I do my Ketsumeisei first thing when I get up in the morning.
And you do how many packets?
I just do 1.
Because you don't have diabetes.
I don't have the moons either.
None?
But I don't have any joint surgeries, so I don't need more. But 1 to 3 of Ketsumeisei, depending on the severity of the problem. And usually you're going to see the results within 10 days to 2 weeks.
What kind of results? What kind of results can one expect to see within 10 days to 2 weeks if they're taking the right amount of Ketsumeisei?
Well, of course it depends on the condition. But let's say you got cold hands and cold feet. That should be improved within 2 weeks.
Okay.
Erectile dysfunction, 10 days to 2 weeks. Congested liver, you're looking at a much longer time because you've probably got some problem with the colon being, caked on walls, and so you're not getting the cleansing like you should. But that's the beauty of these products, is that all the person has to do is get it started and listen to what the body's telling it. I mean, if you've got sores like that picture, and 2 weeks later or 3 months later, you just constantly see it getting better and better and better. Once it's better, you can cut back. The enzyme, same way. You keep taking more and more and more until there's enough in your body to do what it needs to eat up all the old scar tissue. Once it eats it up, it doesn't need as much.
So you have to find your proper loading dose.
Yes. There's no set rule for any of us. I'm amazed when I see the medical doctors do a prescription. They tell everybody the same. How is that possible? That this dosage is the same for a person that's 40 as this person that is 60, or this person at 40 has got a worse problem than the 60. How do they come up with that? There's no magic formula. But that's the problem with synthetic drugs, is that it's forcing the body to do it. Products like Ketsumeisei and Vitalzym, you're not forcing the body to do anything. You're just making it available so it can do what it needs to do. That's the beauty. And you're the controller of your dosage. You don't need to go to the doctor and say, well, doc, I'm doing better. Can I cut back? You don't need that doctor's permission. You know you're better. You cut it back. I mean, if you've got a blood sugar problem and you're running 150 to 200 and you're checking your own blood sugars and it's down to 80 or 90, you don't need as much because it's doing what it's supposed to.
Is that a typical example of what one can expect to see on the Ketsumeisei? Someone who has a blood sugar of something like 150 to 200 within 90 days, if they're taking...
Oh, in 90 days, type 2 diabetic it'll just reverse. It just reverse. Now, that doesn't mean you can go out here and eat all the sugar you want. You got to use some sense with this. The product is designed to help you get to a more normal, static body.